Good morning, everybody. Our today's class is on the arterial supply of brain. Learning objectives for my today's class are: I'll be describing blood supply of brain under following headings: peculiarities of brain and its arteries, vertebrobasilar system, carotid system, especially internal carotid artery, will be described in detail. We'll also describe Circle of Willis. Applied anatomy of above vessels will be described in detail. Brain is highly vascular structure. It consumes about 750 ml of blood per minute. Weight of brain is 2% of the body weight, but it uses 20% of oxygen. It is highly sensitive to ischemia. Interruption of oxygen for 10 seconds leads to loss of consciousness. A neuron survives only for about 6 minutes without oxygen. So nature's mechanism for providing uninterrupted blood supply to the brain. Each vessel passes through a foramen. This prevents kinking of blood vessels during head movements. Brain has got dual blood supply from terminal branches of internal carotid and vertebral arteries. There exists anastomosis between the terminal branches of internal carotid artery and vertebral arteries. Arterial supply of brain is derived from vertebral and internal carotid artery. The vertebral arteries supply blood to the posterior circulation, and the carotid arteries supply blood to anterior circulation of brain. These two important sources of blood supply are directly connected at Circle of Willis. This nature's backup system provides collateral circulation in case some of the vessel is occluded. So the blood supply of the brain comes from the terminal branches of internal carotid artery, which form the anterior circulation, and terminal branches of vertebral artery, which form posterior circulation. Now these two circulations are connected to each other in the form of Circle of Willis. Let us go to the anterior circulation. Internal carotid artery forms the anterior circulation. The common carotid artery divides at the level of body of fourth cervical vertebra into internal and external carotid arteries. This site is referred to as carotid bifurcation and contains the carotid body. External carotid artery gives 8 branches in the neck, but the cervical part of internal carotid artery gives no branches in the neck. The branches given by the external carotid artery include superior thyroid, lingual, facial, ascending pharyngeal, posterior auricular, occipital, and maxillary. Internal carotid artery, which forms the anterior circulation, is a direct continuation of internal carotid artery are middle cerebral artery and anterior cerebral artery. The anterior cerebral artery is the smaller of the two and supplies medial surface of frontal and parietal lobes. The internal carotid artery supplies frontal, parietal, and the temporal lobes, as well as diencephalon. Ophthalmic artery, a branch of cavernous part of internal carotid artery, supplies eyes and parts of paranasal sinuses. Internal carotid artery is divided into several segments. As shown in this diagram, pars cervicalis or cervical segment is the cervical part of internal carotid artery. Pars petrosa, this is a part of internal carotid artery which lies in the petrous part of the temporal bone. Pars cavernosa, that also called the cavernous part of internal carotid artery, and pars cerebellalis, it is the cerebral or subarachnoid part of the internal carotid artery. Each of these segments, with the exception of pars cervicalis, has numerous branches. As shown in this diagram, the terminal branches of the common carotid are middle cerebral and anterior cerebral arteries. From internal carotid artery, anterior and middle cerebral arteries arise as terminal branches. Two anterior cerebral arteries are joined by anterior communicating artery, and internal carotid arteries are connected with the posterior cerebral artery by posterior communicating artery. Branches of internal carotid artery. As already said, internal carotid artery is divided into cervical, petrous, cavernous, and subarachnoid segments. In this lecture, we are particularly going to discuss the terminal branches of internal carotid artery. The branches of internal carotid are hypophyseal artery, which supplies the pituitary gland, ophthalmic artery, which supplies eyes and paranasal sinuses, posterior communicating artery, which connects the internal carotid artery with the posterior cerebral artery. Anterior choroidal artery is an important branch. Then terminal branches are middle cerebral artery and anterior cerebral artery. Hypophyseal arteries. They arise from the cavernous part of the internal carotid artery, a single inferior from the cavernous part of internal carotid artery, as shown in this diagram, and several superior branches called superior hypophyseal arteries on each side. They arise from the supraclinoid part and from anterior and posterior cerebral arteries. Other branches of internal carotid artery are ophthalmic artery, also arises from the cavernous part of internal carotid artery, supplies eyes, paranasal sinuses, and parts of nose. And posterior communicating artery runs backwards to join the posterior cerebral artery. Anterior choroidal artery supplies choroid plexus of temporal horn of lateral ventricle and other areas including optic tract, uncus, hippocampus, lateral geniculate nucleus, etc. In this diagram, we can recap the branches of internal carotid artery. So, from internal carotid artery, we have the superior hypophyseal artery, inferior hypophyseal artery, posterior communicating artery, anterior cerebral artery, middle cerebral artery as a terminal branch of internal carotid arteries. Occlusion of internal carotid artery leads to ipsilateral blindness if ophthalmic artery is involved. Occlusion of ophthalmic artery leads to ipsilateral blindness, half vision of the contralateral eye due to infarction of optic tract, lateral geniculate body, which are supplied by anterior choroidal artery. In case of right internal carotid artery involvement, there is left temporal hemianopia and right nasal hemianopia due to lesion of optic tract. Terminal branches of internal carotid artery. Middle cerebral artery, it branches of frontal, parietal and temporal branches supplying primary motor and premotor cortex, frontal eye field, primary somatosensory area. Left middle cerebral artery supplies language center. So occlusion of middle cerebral artery causes paralysis of face, aphasia due to involvement of language center. Hebner's recurrent artery. Two anterior cerebral arteries are joined by anterior communicating artery. Recurrent artery of Hebner originates from anterior cerebral artery. It is also called medial striate artery. It supplies corpus striatum and its occlusion causes hemiparesis. Blood supply of internal capsule and basal ganglion. They are supplied by perforating arteries. The upper part of these structures is perfused by perforators of middle cerebral artery. The lower and the anterior part is perfused by perforators of anterior cerebral artery. The lower and the posterior part is perfused by perforators of anterior choroidal artery. The genu of the capsule is perfused by perforators of internal carotid and anterior choroidal arteries. Let us have a recap of the arterial supply of basal ganglion and internal capsule. As shown in this diagram, The lower and the anterior part is supplied by perforators of anterior cerebral artery. The upper part is perfused by perforators of middle cerebral artery. The lower and the posterior part is perfused by perforators of the anterior choroidal artery. The genu of internal capsule is perfused by perforating branches of internal carotid and anterior choroidal arteries. Arterial supply has been made very simple in this diagram. Anterior limb is supplied by the straight branches of anterior cerebral artery, including the largest branch, recurrent artery of Hebner and middle cerebral artery. As shown in this diagram, the genu is supplied by the anterior cerebral, middle cerebral, and direct branches from internal carotid artery. Posterior limb of internal capsule is supplied by the straight branches from middle cerebral, including the large Charcot artery of cerebral haemorrhage and anterior choroidal artery. Sublentiform part of internal capsule is supplied by straight branches from posterior cerebral and anterior choroidal arteries, and retrolentiform part is supplied by straight branches from posterior cerebral artery. Clinical importance of anterior cerebral artery. Occlusion of anterior cerebral artery causes contralateral paralysis and sensory deficits in the leg and perineum, urinary incontinence, and often there is mental confusion, as this artery supplies the superior medial surface of frontal and parietal lobe, where the lower limbs are represented in the paracentral lobule. Posterior circulation. Posterior circulation is also called vertebrobasilar circulation. It is formed by the two vessels. We call them as vertebral arteries. Vertebral arteries originate from the subclavian artery, one on the right and another on the left side. These vessels pass through transverse foramina of first to sixth cervical vertebrae. At the level of foramen magnum, the vertebral arteries pierce the posterior atlanto-occipital ligament, dura and arachnoid to reach the subarachnoid space, as shown in this diagram. Vertebral artery is divided into various segments. As shown in this diagram, vertebral artery is also divided into 4 segments. Segment 1 of the vertebral artery is from its origin till it enters the foramen transversum of 6th cervical vertebra. Second segment is called the vertebral segment. Second vertebral part is located inside the foramen transverse area of upper 6th cervical vertebrae. The third part is called the suboccipital part. This part is located inside the suboccipital triangle. The fourth part is also called the intracranial part. It goes from foramen magnum to the lower border of the ponus, where the two vertebral arteries join together to form the basilar artery. Branches of vertebral artery. Posterior supinal artery is the first intracranial branch. Posterior inferior cerebral artery, it is the largest branch of the vertebral artery. Anterior supinal artery is a single artery. Posterior supinal arteries, they are paired arteries. You can remember anterior is alone, A for alone, and posterior is paired, P for paired. The posterior supinal arteries, they are 2 in number, one from each vertebral artery. This vessel passes inferiorly on the supinal cord among the dorsal root lattice of supinal nerves. It commonly arises from posterior inferior cerebellar artery, as shown in this figure. Here this arises from posterior inferior cerebellar artery. In addition to supplying the posterior 1/3 of the supinal cord, It also supplies blood to the medulla oblongata. Posterior half of medulla oblongata below the level of olivary nucleus is supplied by posterior spinal arteries. Anterior spinal arteries, as already said, it is a single artery. Originates from both vertebral arteries. At its origin, there is a small branch from each vertebral artery which join to form a single vessel. In addition to supplying spinal cord, it also supplies blood to the medulla oblongata anterior to the central canal. Posterior inferior cerebral artery, it is the largest branch of the vertebral artery. In addition to cerebellum, it supplies blood to the posterior part of the medulla above the inferior olivary nucleus. Basilar artery is formed by union of two vertebral arteries at the inferior border of the pons at the pontomedullary junction. It ends at the superior border of pons by dividing into two posterior cerebral arteries. It lies on the median groove of pons in cistern of pontis, on the basilar part of the occipital bone and dorsum sella of sphenoid. Branches of basilar artery: anterior inferior cerebral artery, labyrinthine artery. Numerous branches to the pons, we called them as Pontine artery, superior cerebellar artery, posterior cerebral arteries. Anterior inferior cerebral artery arises at the lower border of the pons, turns laterally superficial to 6th, 7th and 8th cranial nerves, then loops over flocculus. It supplies anterior inferior part of the cerebellar hemisphere. Labyrinthine artery, it originates from basilar or anterior inferior cerebellar artery. It lives through internal acoustic meatus. It is accompanied by the vestibulocochlear and facial nerve to the internal ear. It supplies the adjacent part of facial nerve. As shown in this diagram, it arises from the basilar artery, but it may arise from anterior inferior cerebral artery as is shown in this diagram. Pontine arteries, as already said, numerous slender pontine branches pierce the pons, some close to midline and others laterally. Pontine haemorrhage. It is caused due to the rupture of the pontine artery. It is clinically characterized by hyperpyrexia due to the thermoregulatory mechanism disruption, pinpoint pupil due to contraction of sphincter pupillae, coma due to involvement of the reticular formation, and contralateral upper motor neuron paralysis due to involvement of pyramidal fibers. Posterior cerebral artery. Two large terminal branches of basilar artery diverge at the superior border of the pons. Each sends number of central branches into the ventral surface of the midbrain and then curves posteriorly around the upper part of the midbrain to inferior medial surface of corresponding hemisphere. Branches of the posterior cerebral artery are anterior and posterior temporal arteries. They supply the temporal lobe. Medial and lateral occipital arteries supply the occipital lobe. Calcarine artery supplies the visual cortex. This involvement of this vessel leads to homonymous hemianopia. Medial and lateral posterior choroidal artery, they supply the choroidal plexus. Posterior communicating artery, this vessel connects the internal carotid artery with the posterior cerebral artery. It is a slender branch and is one of the common sites of intracranial aneurysms. Now, what is subclavian vertebral artery steal syndrome? It is a phenomenon causing retrograde flow of ipsilateral vertebral artery due to stenosis or occlusion of the subclavian artery proximal to the origin of the vertebral artery. As shown in this figure, Here the proximal part of subclavian artery proximal to the origin of left vertebral artery is stenosed or blocked due to some reason. Is stenosed or blocked. So what happens? Now the blood from the right vertebral artery reaches the circle of the Willis, and from there it is diverted into the distal part of the left subclavian artery. Usually it is asymptomatic and is picked up during routine Doppler examination of carotid system, but at times it presents with vertigo in about 50% of the patients. Syncope is reported to be exhibited in more than 10% of the patients with this syndrome. Blood supply of cerebellum. The anterior inferior cerebral artery is the first branch of the basilar artery. The posterior inferior cerebral artery is a branch from vertebral artery. The superior cerebral artery is the final and the largest branch of the basilar artery before it splits into the paired posterior cerebral arteries. So arterial supply of the brain stem. The brain stem and the cerebellum are supplied by basilar and cerebellar arteries or branches of these vessels. The branches are differentiated into medial, mediolateral and lateral portions based on their localization and which anatomical territory they supply. Arterial supply of the medulla. As shown in this animation, the cylindrical peak represents the medulla oblongata. This white dot represents the central canal. Throughout the medulla, the anterior supinal artery supplies a region beginning at the central canal or anterior border of the fourth ventricle and fans out to encompass the pyramids. So this part is supplied by anterior supinal artery. Now area of the medulla oblongata posterior to the central canal is divided into two parts. Below the level of the olivus, the posterior half of the medulla is supplied by the posterior supinal artery. And above the level of the olivus, the remaining portions are supplied by posterior, inferior, cerebellar and vertebral arteries. Now what is circle of the Willis? Is a circulatory anastomosis between the vascular territory of carotid arteries, which form the anterior circulation, and the vascular territory of the vertebral arteries, which form and or posterior circulation. The anterior and the posterior circulations are connected via paired anterior and posterior communicating arteries. Function of circle of Willis. Circle of Willis is also called Circulus Arteriosus. It equalizes blood flow to the different parts of the brain. Therefore, if one part of the cerebral circulation is occluded, the circle of Willis allows collateral supply via an alternate route. As shown in this diagram, we have the terminal branches of internal carotid artery, which are anterior cerebral artery. These two vessels are joined by the anterior communicating artery. Two vertebral arteries join together to form the basilar artery. The terminal branch of the basilar artery is the posterior cerebral arteries. These posterior cerebral arteries are joined with the internal carotid artery by posterior communicating artery, thus forming a pentagonal anastomosis between anterior and posterior circulations. This pentagonal anastomosis is called circle of Willis. So the circle of Willis is a polygonal anastomotic channel at the base of brain or in the interpedunclar fossa. Two sets of arteries are there. We have internal carotid artery, which supply the frontal parietal lobes and parts of the temporal and occipital lobes. Vertebrobasilar arteries, they supply the brainstem, cerebellum, parts of temporal and occipital lobes. From this slide, we conclude that parts of temporal and occipital lobes are supplied by both branches of internal carotid artery and vertebrobasilar system. Branches of circle of Willis. We have anterior medial branches from anterior cerebral artery and anterior communicating arteries. Posterior medial branch from posterior cerebral arteries and posterior communicating arteries. Paired branches arise from anterolateral. Paired branches are anterolateral from anterior and middle cerebral artery, and paired posterior lateral branches from posterior cerebral artery. As shown in this diagram, we have anterior medial branches from anterior communicating and anterior cerebral artery. Posterior, we have posterior medial branches from posterior cerebral and posterior communicating artery, and we have paired branches from anterolateral, and we have paired branches from middle cerebral artery. Cortical branches of Circle of Willis. These cortical branches arise from anterior, middle, and posterior cerebral arteries. They are called cortical because they supply the cerebral cortex. They ramify on the fibula and form anastomosis, supply gray matter and subjacent white matter. There are two sets of cortical arteries. Short cortical arteries, as the name indicates, extend up to the middle of the gray matter because of their shorter length, and long cortical arteries, they are 3 to 4 centimeters long, longer than the short cortical arteries. They run up to the superficial white matter. Then another type of the branches which are given by the Circle of Willis are called the central branches. These branches penetrate the base of brain. They supply the internal capsule, thalamus, and basal ganglion. They are arranged in 4 sets: anteromedial, paired anterolateral, and paired posterior-lateral, as is true of the cortical branches, and paired posterior-medial branches. Both central and cortical arteries are surrounded by a pile sheath up to precapillary level. Now, what are lenticulostriate arteries? Clinically most important central branch of middle cerebral artery is called lenticulostriate artery. They pierce the anterior perforated substance and enter white matter, pass through lentiform nucleus to reach the internal capsule. They supply upper part of the internal capsule and lentiform and caudate nucleus. Some are long, slender, thin walled, and prone to rupture in hypertension. These vessels are called Charcot arteries of cerebral haemorrhage. As shown in this diagram, middle cerebral artery originating from internal carotid artery gives straight branches which supply putamen, thalamus, caudate nucleus, and internal capsule. With the internal carotid artery, from internal carotid artery we have middle cerebral artery. From middle cerebral artery we have straight branches which perforate into substance of the brain and supply blood to the thalamus, putamen, caudate nucleus, and internal capsule. As already said, these are commonly involved in cerebral haemorrhage, and these vessels are called the Charcot vessels of cerebral haemorrhage. Aneurysms of Circle of the Willis. Though Circle of Willis provides collateral circulation at the base of the brain, but there are also some disadvantages associated with this circle. The anterior and the posterior communicating arteries are clinically important because they are the frequent sites for intracranial aneurysms. An aneurysm is a pathological vascular dilatation which can result in subarachnoid hemorrhage if the aneurysm ruptures. What is the role of 3 cerebral arteries, that is anterior, middle, and posterior cerebral arteries, and consequences of their involvement in cerebral stroke? In other words, what are the areas supplied by these cerebral arteries? Anterior cerebral artery supplies medial surface of the frontal and parietal lobes. It also supplies a strip of superolateral surface of these lobes. Since the lower limbs are represented on the medial surface, that is in the paracentral lobule, lesion of anterior cerebral artery causes involvement of the legs below the level of knees, and also it involves the urinary bladder, which is represented in the paracentral lobule. Middle cerebral artery supplies superolateral surface of the frontal and parietal lobes. Middle cerebral artery also supplies large part of the lateral aspect of the cerebral hemisphere, including Broca's and Wernicke's areas, the primary motor and sensory language centers respectively. Posterior cerebral artery supplies occipital lobes. It also supplies the medial surface of the temporal lobe. Since the visual cortex is located in the occipital lobe, lesion of posterior cerebral artery or calcarine artery, which is a branch of posterior cerebral artery, causes visual impairment in the form of homonymous hemianopia. It also causes loss of memory. Stroke is defined as damage to the brain due to interruption of its arterial supply, and it is also called the cerebrovascular accident. Strokes are of two types: ischemic stroke or embolic stroke. This type of stroke is caused by occlusion of a blood vessel by embolus. The second type of stroke is hemorrhagic stroke. This type of stroke is caused due to rupture of a cerebral vessel. The clinical signs and symptoms of stroke depend on which blood vessel and corresponding brain tissues are affected. As shown in this figure, this is embolic stroke, where a blood vessel is blocked due to embolus from the heart, leading to ischemic stroke. In the second case, there is rupture of the blood vessel, maybe due to the underlying aneurysm, leading to hemorrhage and damage to the cerebral cortex. So there are two types of the strokes. Ischemic stroke may be thrombotic or embolic. Then second type stroke is hemorrhagic stroke. Ischemic strokes are more common. They account for 80% of all strokes, while hemorrhagic strokes are less common. They account for 20% of the strokes. Or these hemorrhagic strokes are further divided into intracerebral 15% and subarachnoid 5%. Hemorrhagic stroke is shown in the second diagram as a hyperechoic shadow on CT. Representation of the body. What will be the effects of the occlusion of the various cerebral vessels? To understand this, we must know the representation of the body in cerebral cortex. Body is represented upside down in cerebral cortex. So limb is represented over the medial surface or in the paracentral lobule. Legs are represented on the medial and superior lateral surface of the parietal lobe. Second important thing to remember is area of representation is equal to the activity of the organ. If the organ is active, it is represented by a larger area than if the surface area of the organ is larger but it performs less activity. For example, as shown in this diagram, hands, lips and feet occupy more representation in the cerebral cortex than the trunk and gluteal region. Right cerebral hemisphere is dominant in the left-handed persons, and left cerebral hemisphere is called a dominant hemisphere in the right-handed persons. Now let us go to the lesions of various cerebral arteries. Lesions of anterior cerebral artery which occur in stroke. The classical clinical presentation of stroke in anterior cerebral vascular territory includes the hemiparesis, that is weakness, which involves the legs more than the arms and is always contralateral to the vascular lesion. This is because anterior cerebral artery supplies the frontal, prefrontal and supplementary motor cortexes as well as part of the primary motor and sensory cortex. Additionally, occlusion of anterior cerebral artery can lead to bladder dysfunction. Lesions of middle cerebral artery. The classical presentation includes the contralateral hemiparesis weakness as well as the sensory deficits. Aphasia. The inability to speak may also occur when the dominant hemisphere for language is affected, which is the left hemisphere for most right-handed people. Involvement of posterior cerebral artery is very important. Posterior cerebral artery supplies the occipital lobe and medial portion of the temporal lobes. Involvement of it may result in syndrome of memory impairment, opposite visual field loss in the form of homonymous hemianopia, and sometimes hemisensory deficits if thalamus is also affected. Summary: brain is a highly vascular organ but also highly sensitive to ischemia. It receives protected dual and collateral arterial supply from terminal branches of internal carotid and vertebral arteries. Collateral circulation is provided by Circle of Willis in case of arterial occlusion. Despite these mechanisms, strokes do occur either by occlusion of or rupture of a vessel, rupture or anterior and posterior communicating arteries leading to subarachnoid hemorrhage. Early diagnosis and intervention of these ruptured aneurysms reduces the mortality. Now let us go for a quiz based on this lecture. You will be provided an MCQ with 4 options. You have to choose the most accurate one. Our first question is, common carotid artery divides into external carotid artery and internal carotid arteries at the level of body of first cervical, second cervical, third or fourth cervical vertebra. The correct answer is it divides at the level of fourth cervical vertebra. Ophthalmic artery originates from which part of internal carotid artery? Cavernous, petrous, subarachnoid, intracranial. The correct option, it originates from cavernous part of internal carotid artery. Our next question is, which artery is commonest site of aneurysm? Anterior communicating artery, anterior cerebellar artery, middle cerebellar artery, posterior cerebral artery. As already said, anterior and the posterior communicating arteries are commonest sites of cerebral aneurysms, and these aneurysms rupture to cause subarachnoid hemorrhage. Which is a false statement about subclavian steel syndrome? Clavian vertebrobasilar syndrome. Due to the stenosis of subclavian artery proximal to the origin of ipsilateral vertebral artery. Due to stenosis of subclavian artery distal to the origin of vertebral artery. D may be asymptomatic. So the wrong option is stenosis of subclavian artery distal to the origin of vertebral artery. The correct answer is stenosis of subclavian artery proximal to the origin of vertebral artery. Our next question is, false statement about the labyrinthine artery is originates from basilar artery. It is true. May originate from anterior inferior cerebral artery. False. Accompanies the vestibulocochlear nerve to the internal ear. True. Supplies the adjacent part of the facial nerve. True. The false statement is may originate from anterior inferior cerebral artery. It may originate from anterior inferior cerebellar artery, not cerebral artery. Involvement of anterior cerebral artery in stroke affects upper limbs, lower limbs below the level of knees, both limbs, momentous of the tongue. The correct answer is lower limbs below the level of knees, as lower limbs are represented over the medial surface of cerebral hemisophere supplied by anterior cerebral artery. Which of the following arteries lies on the stem of the lateral sulcus? Which of the following arteries lies on the stem of the lateral sulcus? A is anterior cerebral artery, B is middle cerebral artery, C is anterior communicating artery, D is posterior cerebral artery. So the correct option is middle cerebral artery. Now our next question is, which of the following arteries mainly supplies superior lateral surface of the brain? Anterior, middle, anterior communicating, posterior cerebral. So correct answer is middle cerebral artery. Which of the following arteries supplies medial surface of the brain? Anterior cerebral artery, middle cerebral artery, medial communicating, posterior cerebral artery. The correct option is anterior cerebral artery. Internal carotid nerve is composed of preganglionic sympathetic fibers, parasympathetic fibers. C is sympathetic fibers on the internal carotid artery. D is parasympathetic fibers on the internal carotid artery. The correct answer is sympathetic fibers on the internal carotid artery. Here I want to mention that everywhere in the body, sympathetics, they go with the blood vessels. Internal carotid nerve is basically plexus of sympathetic fibers from the superior cervical ganglion, which accompany the internal carotid artery Our next question is involvement of posterior cerebral artery in stroke results in homonymous hemianopia, hemianopia, heteronymous hemianopia, bitemporal homonymous hemianopia. The correct option is homonymous hemianopia. The calcarean artery, being a branch of posterior cerebral artery, supplies the occipital cortex, so its involvement cause is homonymous hemianopia. Our next question is, a patient presents with sudden onset of pyrexia, pinpoint pupil and paralysis. Which artery is involved? The triad of pyrexia, pinpoint pupil and paralysis is classic of Pontine haemorrhage. So the Pontine arteries are involved in this setting. Do not forget to subscribe this channel. Press on the bell icon to remain updated about more videos. Thank you very much for watching this video.